12.3 Healthcare Markets. In this chapter, we look at the healthcare markets of the United States from an economic perspective. What are the economic problems these markets face? How do our healthcare arrangements deals with these problems? How do other countries deal with the same problems? Does US healthcare need reform? Economic problems in healthcare markets. Healthcare is two distinct products. Health insurance, insurance that pays healthcare bills. Healthcare services, the services of physicians, specialists, nurses, other healthcare professionals, and hospitals. Left to competitive market forces with no government intervention, both health insurance and healthcare services would be underprovided for three economic reasons. Asymmetric information, missing insurance market, public health externalities. The first one is asymmetric information. Asymmetric information, which brings adverse selection and moral hazard, is present in both markets. In the insurance market, the buyers have private information, and in the car market, the sellers have private information. Adverse selection arises because some of the healthiest people choose to be uninsured, at least during their younger years. Moral hazard arises because once insured, a person has less incentive to adopt to a healthy lifestyle, and some will yield to the temptation to drift into unhealthy habits. Faced with a lack of information about individual lifestyle choices, health insurance providers like auto insurance suppliers offer lower premiums with high deductibles so that buyers can reveal information about their lifestyle. The fittest and healthiest choose a high deductible and low premium, and the least fit and unhealthiest choose a low deductible and high premium. The market finds a separating equilibrium. Moral hazard in healthcare services. High quality providers of healthcare services diagnose and prescribe treatments reliably and at the lowest possible cost. Low quality providers make diagnosis errors and overprescribe expensive drugs and other treatments. But the information about the quality and reliability of the healthcare provider is private. The buyers, that is, patients and insurance companies' services, is like the market for used cars. Moral hazard arises that increases the cost of healthcare services. Providers have an incentive to play safe and overtreat a patient. Neither the patient nor the insurance company has information with which to prevent this inefficiency. Health maintenance organizations partly address this moral hazard problem. By working with a limited number of service providers, an insurance company can monitor the quality of the service and control costs. But even with this arrangement, the service provider has more information than the insurer, so the problem is lessened but not completely overcome. Missing insurance market. Many people can't get private health insurance because they're too old or too sick or too disabled. Others with pre existing conditions can get insurance, but only with exclusions of the very health problems they are most likely to encounter. These are the people who have the greatest wants for health care, but the least ability to get it without some alternative to the free market. The missing insurance market is one that is blind to a person's known health risks. This market can be provided only with government intervention. The US healthcare system deals with this problem by government provision of health insurance. Medicare pays the hospital cost and subsidizes the treatment cost of the aged over 65 and some of the long term disabled. Medicaid pays the healthcare cost of those living in poverty and with long term healthcare needs. The government programs provide health insurance for 93 million people but missed an estimated 48 million. Their total expenditure on them is driven by patient demand, not by decision of Congress. As the population gets older and advances in medical technology keep people alive longer with expensive treatments, the cost of these programs grows. Public health externalities. The control of infectious diseases is a public good. So, public sanitation systems, which general public health relies upon, are provided by government to avoid a free rider problem. Vaccination against an infection disease is a private good, but one with a positive externality. People who get a flu shot protect not only themselves but everyone with whom they come in contact. The marginal social benefit of flu shots exceeds the marginal private benefit. The efficient quantity of flu shots exceeds the quantity that an unregulated market would provide. This feature of healthcare is a further reason why it is efficient to subsidize the care of aged and those in poverty. We have seen three economic reasons why health card isn't an ordinary good that we can expect the unregulated market to provide efficiently. US healthcare is provided by a mixture of private and public insurance. Healthcare system in other countries. Every major country except the United States has a comprehensive national healthcare system. Every person is insured under a government funded national insurance program. Healthcare services are provided by private clinics, hospitals, physicians, and specialists, but they are paid for by governments. Government expenditure on healthcare is financed by specific health insurance taxes and by general health income taxes. Resources in the public healthcare system are allocated by physicians, specialists, and hospitals and are based on urgency of need, which results in patients often being placed on lengthy waiting lists. No one is permitted to opt out of the National Health Service, but in most countries, everyone is permitted to buy private insurance and private health care. In these countries, what is called two-tier system sometimes emerges in which the rich buy private insurance and get higher quality care, and the poor get health care from a lower quality store system. In a few countries, there is none private portion. It is illegal to open a private clinic and sell private insurance that covers basic care provided by the state system. The idea of this restriction is to avoid the two-tier outcome. The comprehensive national health system limit choice and impose king waiting times, but they do contain costs and they do so without apparently compromising the overall quality of health outcomes. The reform idea. The Medicare and Medicaid programs are in effect an open-ended commitment of public funds to the healthcare of the aged and those too poor to buy private healthcare. Healthcare in the United States faces two problems. Many people are uninsured and healthcare costs too much. These problems are going to get worse if nothing major is done to reverse it. The Protection and Affordable Care Act, known as Obamacare, addresses the first of these problems by requiring everyone to be insured and by creating a new pre-existing condition insurance plan, financed partly by the government. But the Act does little to address the problem of over expenditure, and this problem is extremely serious. It is so serious that without massive change, the present open-ended healthcare programs and plans are ending. A solution to both the problem of coverage and access and the problem of over expenditure has been suggested by Lawrence Kotlikoff, an economics professor at Boston University. His proposal uses healthcare vouchers to ensure universal coverage and a cap on total expenditure. Everyone would get a voucher, and those with higher expected healthcare cost would get a bigger voucher. Healthcare vouchers would work like the education vouchers. They would provide the cost discipline of the European and Canadian systems with the choice that is so important and valued by Americans.